welcome back to Simplified by Jinal Shah. Here we are going to do a drug called Argentum Nitricum. Since I've been getting a lot of requests to do Polycrest, you can follow me on Instagram. My ID is simplified.ed. Now, before starting Argentum, we get into the basic understanding that Argentum is silver, right? So, when we talk about the mind symptoms of silver, we will be correlating it with aurum met, that is our gold, right? We start with the prior understanding that you people know the basic pathophysiology of IBS and or ulcerative colitis or Crohn's disease. So IBS or IBD, if you know the pathophysiology of these two, we could easily do Argentum Nitricum, right? So the most common manifestation of IBS or IBD is diarrhea. We also have conditions of flatulence. There is abdominal pain as well. And another common thing is, which we always talk about, in causative for IBS or IBD, most commonly IBS, is the mental state of the person. Type A personalities, extremely stressed out personalities, personalities allergic to a lot of things, have a tendency for these two illnesses. Now, when I categorize it as IBC, IBS or IBD, I do not mean that we give it only for these conditions, or if you find these conditions, we directly prescribe Argentum. It is just that we can remember the drug much more in a simplified manner. Now, there are multiple remedies and multiple conditions that cause diarrhea and flatulence. So, how is Argentum different? First of all, there are two types of diarrhea in Argentum. For people who do not know, there is one diarrhea of nervous origin, which is going to be related to the mental state, and one of gastric origin. Right, so starting first with the gastric origin diarrhea. The gastric origin diarrhea has an ailment from sweets, candies, milk, and so we know a lot of sugar intake is there. So after a lot of sugar intake or milk, the person lands up with diarrhea. At the same time, if we are going to talk about nervous thing, so it could be mental shock, anticipation into any activity could lead to diarrhea, where the person has either some mental shock, some anticipation, or some anxiety, right? In these two conditions, the characteristic of diarrhea is different as well. This is an important point. Here it is watery green. Okay, so here the diarrhea is watery green, as if chopped spinach. Okay, so it is watery green chopped spinach with mucus. Most commonly, the example that is given in Kent is of a child who's eaten a lot of sweets and candies, and the diaper was filled with chopped spinach with mucus like diarrhea. Whereas when we talk about diarrhea which is of nervous or mental origin, it is different. Here there is going to be a lot of urging. Okay, so the person has forceful diarrhea, and the difference is it is very watery. It might not have the characteristic green color. It is also offensive, uncontrolled. The person has to rush. When we say anticipatory, means, for example, if the person has to do some activity, so before that he'll have diarrhea. He does the activity, finishes it well, diarrhea vanishes, right? So the whole cause of diarrhea is dependent on the anticipation or the task. When the task is done, the person is almost all right. The stools could also have blood and slime in it. That is why I've also mentioned about IBD, because IBS generally wouldn't have bloodiness in it, right? So this is a main part, diarrhea. This comes by itself as a 5 mark question, plus you could expand on it. You could add the constitution, you could add the generals and enlarge this as well. Now coming to flatulence. So it is going to be noisy, it is going to be huge in quantity, both ways. So in textbook it is mentioned air rushes out both ways without any relief. Okay, so comment down below drugs which give relief. Argentum is one drug which does not offer any relief even after passing the gas. Now let us try to understand the mental state of Argentum in a bit. Okay, so there is one important thing, that is anticipatory anxiety, which we've already mentioned here. Now, what all are the scenarios where the person could feel anxious, right? So mostly it could be anything in the modern world. In the textbook it is mentioned as going to church, or any arrangements, engagements, meeting new people, even crossing roads, or public meetings. All right, so these all could be an ailment from for the anticipatory anxiety. I mean, if you know a little bit about psychology, you would understand that people who would have anxiety on public speaking or meeting new people have low self confidence. All right, so since the confidence is low, their ability and want to talk in public reduces significantly. There are two things to it. There is a vicious cycle. Firstly, the person has low confidence, lands up with diarrhea because of the anxiety. This could be purely physiological as well. But at the same time, because the person has diarrhea, he feels the next time he has to go into a meeting, he fears diarrhea as well. So that adds on to his low confidence. So this is going to be a vicious cycle. The person has low confidence, he lands up with diarrhea. The next time he has to make a speech, he's already scared that he might have diarrhea. So the confidence drops down even more. There is low confidence to the extent that there is self reproach. This is very common in patients with ulcerative colitis. I have myself seen a few patients where they kind of hate themselves for their condition. Plus, they have the whole feeling of I am not good enough. Whereas in fact they might be good but just not the best, and that is the whole comparison with Aurum. Aurum knows they are excellent, and Argentum are always second in the place, and there's always the struggle and fight to reach the first place. Alright. Now, when we talk about Argentum and diarrhea and IBD, we have to understand that it is a chronic illness, right? So these mental states have lasted since a really long time to give nervous diarrhea. These mental states have had other consequences as well. If a person has such recurrent diarrheas, he is going to have what we know as malnutrition. All right. We will try to correlate the symptoms with malnutrition. First thing, I think we can go to the constitution now. Constitution is cachectic, scrawny, withered individuals. They are really thin, and the thing they mention about their constitution is that they are growing thinner more in the lower extremities, and it is very progressive. Since, like I said, it is a chronic illness, deteriorating, even the emaciation is quite progressive. So each year you see the patient, he is going to be more withered, more withered. This mental state gives them easy irritability. They likely do not want to be bothered. So this also comes in the constitution. Cachectic, scrawny, withered individual with progressive emaciation every year, more in the lower extremity. Alright. Other thing about malnutrition, what we could think of is vitamin deficiency, so hypovitaminosis due to bad digestion, bad absorption. Alright, so hypovitaminosis could lead, or basic B12 deficiency leads to weakness, trembling, mostly of lower extremities, right? There's a one characteristic symptom mentioned which will distinguish it from other hypovitaminosis, that is cannot walk with eyes closed. So the general sense of proprioception is lost. Since proprioception is lost, the person doesn't understand where he is in time and space. This could also contribute to crossing road anxiety, because then the person has difficulty in crossing road and he fears accidents. At the same time, now let us see the contradictory symptoms. One thing is that he has anxiety of crossing road, but at the same time, when the reproach is too high, he also gets suicidal. And every time he sees some crossing road scenario, he would want to jump in and kill himself in that way. So suicidal tendency increases when crossing roads, when looking down on bridge. So I would say this as crossing road, this as looking down on bridge, right? Or looking out of the window, there is impulse to jump. You usually could get a question on how remedies have suicidal tendencies. Argentum usually has by impulse to jump. Okay. Similarly, here we see sweets has been the aggravating modalities for the diarrhea, but the person desires sweets and candy. So again, we see vicious cycle number 2. This is vicious cycle number 1, vicious cycle number 2. Since there are vicious cycle, we could easily say it is a chronic drug because it just never stops. There is desires for sweet, sugar and salt. Okay. Another thing which could contribute to the weakness and trembling is, which is mentioned in the textbook, is post-diphtheric paralysis. So any other causes? Alright. Now Argentum Nitricum is in general hot remedy, but the contradiction here is it is chilly when uncovered yet feels smothered when wrapped. So I mean, in general terms we could call it ambi, more towards hot. He feels chilly when uncovered, but if he is wrapped up he will feel smothered. Okay, so this is Argentum. There are few more symptoms which we could add on, is about the eye symptoms. If you know ulcerative colitis does have eye complications, please comment down below what are the eye complications of ulcerative colitis. Nevertheless, this drug has or could have complete or total blindness. This is not actually a symptom of ulcerative colitis, but it is a part of the drug. And pupils. Okay, so another thing this mental anxiety could also trigger is epilepsy. So if epilepsy is triggered by these mental symptoms and mental causations, in this condition or because of fright, aggravated with fright, the pupils tend to dilate before attack. So this is an aura symptom where pupils have dilated before attack. So this is Argentum Nitricum. Could finish it in around 15 minutes, but I'm pretty sure I've covered all the points. If you were to answer a 20-mark question on this, you start with the constitution, then you go on to the mind symptoms, and then you talk mainly about the GIT system, which includes all of these things. The mental symptoms included here are pretty basic from Boric. To get an additional idea about mentals, you could check out any other book such as that of Dr. Sankaran. Alright, I hope you've understood this drug well. Please subscribe to the channel if you haven't already, and check out other videos which are similar and have a complete constitution covering 20-mark questions.